Welcome back. The Nigerian Hypertension Society, through its president Simeon Osezua, has called for raising awareness and promoting the prevention, early detection and treatment of hypertension in Nigeria. The call was made in a press statement on May 17th commemorating World Hypertension Day. Dr. Osezua revealed that 1 in every 3 adults in Nigeria has hypertension, according to the society's findings. Osezua highlighted the rising cost of hypertension treatment medicines as a major concern. He emphasized that hypertension often lacks symptoms until serious bodily damage occurs. Therefore, many Nigerians are unaware they have it, and few of those aware receive proper treatment. Obesity, sedentary lifestyles, and diets high in salt, fats, and sugar are driving the increasing hypertension burden. Now, to discuss this, we are joined by CEO co-founder My Medicare, Dr. Chukwuka Pascal Obodo. Good evening and welcome, Dr. Chukwuka. Good to have you.
Good evening. Thank you very much. My pleasure to be here.
Thank you indeed. Now, can you explain what hypertension really is and why it's a major health concern in Nigeria?
Okay, so thank you for that. So when we talk about hypertension, we are referring to when someone checks their blood pressure and is above 140/90. Okay, so the 140, the one above, we refer to as systolic, and the one below is referred to as diastolic. Okay, so and of course it's a global health issue because hypertension on its own can lead to other health challenges. Okay, just as renal failure, stroke, and a whole lot of complications.
Now, let's talk about the stats that we heard. 1 in every 3 Nigerian is hypertensive. How come people don't know about this, and how easy is it for them to actually access affordable hypertension diagnosis?
Okay, well, so most times people don't really know that they're hypertensive because most people don't have the symptoms. Okay, so it's usually when it gets very bad. Okay, that person might start having maybe blurry vision, headaches, and all whatnot. But most people don't actually at the initial stage. Most people don't really have the symptoms, and that makes it quite challenging for for it to be diagnosed. Okay, then moving forward for the rural regions. And of course, in Nigeria as a whole, there's a lot of issues when it comes to the diagnostic sets. Even in some facilities, their machines are not very much in order to be able to pick it on time. In addition to that, Nigerians, quite a lot of people have issues going to the hospital, okay, to check their hypertension, to check their blood pressure. People will tell you, okay, I prefer not to know that I'm hypertensive than to actually visit the clinic and be diagnosed. So these are some of the challenges that that quite a lot of Nigerians will be facing.
So, doctor, what are some of the key risk factors for hypertension that are prevalent in the Nigerian population?
Okay, so number 1 on the list is high salt intake. Okay, salt basically is sodium chloride. Okay, sodium can can increase the what we call the cellular fluid, and that subsequently can lead to the blood pressure being high. In addition to that, we have a lot of people living sedentary lifestyle. Okay, they work in their offices. They don't really move around quite often. Okay. Another thing is medications. People are abusing drugs. Okay. Medication as little as diclofenac, okay, which is an NSAID, can drastically affect the kidney over time if it's taken for a long period of time, and that of course can lead to hypertension. And also you have people taking all sort of what we call above quotes, okay. So this on its own can affect the kidneys and other organs in the body, and leading to hypertension.
So then, what lifestyle changes can Nigerians make to help prevent them or help manage hypertension if they already have it? Could exercise help? Stress management, for instance. Are there any other aids that could help?
Yeah, sure. Exercise go a long way. Okay, exercising daily that can really help to maintain integrity of the heart. In addition to that, avoidance of smoking, alcohol consumption, okay, and losing significant amount of weight. As a matter of fact, if you're able to lose as little as 5 to 10 kg of weight, is very beneficial to the heart, and of that, of course, to your blood pressure, and generally helps you to stay fit.
Well, then, thank you very much, Dr. Chukwuka. Good to have you on the news this evening.
Same here. Thank you very much for your time. Bye.